Hello, welcome to the Ilter Clinic, the world's leading expert in FUE hair transplantation. My name is Dr Demir Ilter and I'm here today to explain the FUE hair transplantation process for you. Sometimes when faced with medical unknowns, it's normal for a patient to feel curiosity and a little bit anxiety. I will try to answer the most common patient questions about FUE hair transplantation. Because FUE is a minimally invasive technique, you should not experience any real pain. On the day of operation, we meet our patient at 7 o'clock in the morning. Our operation staff and the doctor will be ready for your arrival at that time. We take our patient to his room. He will use this room for the rest of the day, for breaks, for lunch, and if it is an unusual long operation, his dinner. For the operation, we prepare the room and me and my nurse go over the operation plan. Because we are well prepared, we do not encounter surprises during the operation. I go over what the patient needs and wants for the last time. I like to verify this with the patient one more time. Our routine is to invite our patient to our studio to take the before photographs and cut his hair to get ready for the operation. What actually takes place during the operation? Patients sometimes unknowingly tense their bodies during the procedure. So they are giving a mild muscle relaxant to avoid muscle pains. Depending on the number of grafts needed, the operation can take anything from 4 to 13 hours, including 1 to 4 one-hour breaks. Generally, we finish extraction before the lunch break. After the break, I examine the patient's face, looking for possible clues of the previous hairline. I combine my findings with the amount of grafts I have on hand. Because your donor supply is not unlimited, my biggest concern as a surgeon is to achieve the best possible result with the least amount of your donor supply. After lunch, we design the new hairline with the input of the patient. During this period, I give the patient a mirror and discuss with him my suggestions. Many times the patient has no objections, but sometimes they make little changes. When we both agree, we start placing the grafts in their new homes. What happens after the operation? When the procedure is finished, the staff takes the operation pictures and gives you the patient a list of do's and don'ts. The patient also receives a package which contains some medicine and materials to be used in the days following the operation. Including the package, there are also special shampoos and ointments to be used later. The skincare products you will find in the package will need to be used the following weeks after the operation. Our patients usually leave the clinic to go home with nothing more special than a baseball cap like the one you see here. They can get on with their lives immediately after the procedure. You might ask, do we send our patients home and forget about them? This is not so. We schedule an appointment with our patients 2 to 3 days after the operation to check the healing process. We also give the patient his first post-operative hair wash and perform a lymph drainage massage on his forehead. Now you know what you can expect before, during, and after the operation. There's another question you might ask. Are there any complications with this procedure? To be honest, it's hard to think of any complications. Choosing to perform FUE was a conscious and rational decision on my part. Why? Because this technique is almost risk-free. The operation itself is like flying a plane on autopilot. Nature takes care of everything and all signs of the operation disappear in a matter of days. Forcing myself, the only complication I can think of is that we sometimes cannot achieve the patient's expectations of density. When we were using the industry standards of 1 millimeter instruments, there has only been 1 or 2 cases of scarring and empty spaces visible to the naked eye. Although we did not receive any complaints about this and the patient did not notice this, we did. That is the main reason why we came up with FUE-IM. With the help of those cases, we developed smaller instruments and now can perform with the smallest instruments. Now the risk of getting empty white spaces in the donor site is no longer an issue. Usual surgical complications of bleeding, infection, permanent numbness, and permanent neurological damages are non-existing in the FUE-Ilter method. You should be prepared that hair growth after the operation is not immediate. Most of the newly transplanted hair will go through a sleeping period to get their act together and continue to produce hair for you for the rest of your life. New hair growth will gradually start after the sleeping period. This period differs from one patient to the other. Some will see growth in 2 months, while others will have to wait for 7 or more months. We usually prepare our patients for the longer period. By the 9th month, the new hair is functional, and by the 12th month mark, it is now reliable. Lastly, I want to talk to you about an issue I found very important in hair transplantation, and that is designing your hair for the future. If your hair loss has already started, it means it will progress. In this case, do you think it's wise to use up all your possible donor supply? Saving some for continued hair loss and accessing them at a later date is more beneficial and feasible both for you and for us. You want to look good into the future, and we want to stay in this business and maintain our reputation. Thank you for giving me the opportunity to answer your questions. I hope to see you as a member of the Ilter Clinic family. Take care.